The Sleep Habits in Baby's Guide: How to Reach Health Sleep Habits Without Tears. Written by Charles Clarke and narrated by Oliver Martins.
Chapter 1. Why a good sleeping habit is important for both parents and babies. Answers to the above inquiries regarding rest are considered by a few strategies. Polysomnography, customarily in the research center, however now additionally in the home. Actigraphy, for the most part in the home. Videosomnography, as a rule in the home. And parent report instruments. For example, rest logs, rest journals, and organized surveys. Frequently, a large number of these strategies are utilized at the same time. In any case, an increasingly far-reaching research setting for understanding the unfurling of newborn child rest-wake designs in early improvement uses a value-based model that evaluates a few of the different components that affect the parent-kid relationship. Proximal effects on the relationship incorporate the essential guardian's present condition of physical and mental prosperity. The essential parent's figure's own youth encounters of being parented, including their encounters around sleep, current social encouraging groups of people, the family's financial and family condition, and the baby's personality and physical well-being. Stressors, for example, newborn child physical sickness or maternal wretchedness additionally fill in as proximal components that straightforwardly sway parent-youngster cooperation and the kid's rest. Progressively distal factors in the value-based model incorporate the more extensive social setting and convention frameworks of the family and increasingly aberrant natural impacts. Inquiries for further research far dwarf answers presently accessible. Which of the few strategies for estimating rest in these youthful populaces is generally fit? By which means should the issues of concordance between various chronicle strategies be settled? Is rest sorted out in youngsters with clinical issue, particularly neuroformative issue, than in normally creating kids? Are the organized instruments and parent surveys substantial for youngsters with restorative issue? Enormous scale, diverse, populace-based, longitudinal epidemiologic examines are fundamental if experts are to inform guardians. Longitudinal epidemiological examines are fundamental if experts are to inform guardians about what the range concerning ordinary rest practices are for a specific age gathering of youngsters. How are such investigations to be mounted? Is co-resting helpful or unsafe for a newborn child's well-being? Is co-resting helpful or unsafe for the newborn child's well-being, physical prosperity, and self-sufficient advancement? What sort of treatment, social, psychopharmacologic, psychotherapeutic, which, assuming any, newborn child, parent, or psychosocial factors advances rest conduct? Which, assuming any, newborn child, parent, or psychosocial factors advances rest conduct? What is the connection between evening time rest disturbance, daytime sluggishness, and daytime social interruption? What are the long-haul ramifications of ceaseless rest aggravations in early youth? There is a solid relationship between parent-baby collaboration around rest and the development of newborn child rest practices. Guardians who effectively shake or hold their newborn child until snoozing, i.e., increasingly associated with settling their baby to rest, rather than guardians who enable their babies to nod off without anyone else, have newborn children who present more evening waking issues. These affiliations may result from an immediate impact on parental conduct on baby rest, or from newborn children with troublesome demeanors who request progressively parental inclusion during the night. The significant job of guardians has been set up by anticipation contemplates that have exhibited that changing parental information about newborn child rest preceding the youngster's introduction to the world can advance better rest. In addition, clinical examinations on conduct meditation for clinical administration of rest issues have shown that utilizing guardians as the essential interveners produces dependable and sturdy changes in newborn child rest.
Sample complete. Ready to continue?